Hi, thank you for the introduction. And I'm Dr. Kevin Wong, and I'm an interventional pain management physician at Eisenhower Desert Orthopedic Center. I joined Eisenhower about 3 years ago, and this is actually going into my fourth year. I love the valley. I love the people here. Everybody has been very kind here. It's like a family here. And I primarily see patients in Palm Springs, South Palm Canyon Drive. We have a very nice historic building there. And I do also see patients once a week in Rancho Mirage local in the main campus of Eisenhower Health in the Rancho Mirage. So what we're going to talk about today is we're going to talk about how do we manage chronic pain through what we call a multidisciplinary approach? Sometimes chronic pain is a disease. It's sometimes that it's not really treatable, but there are certain ways that we can manage it so we can certainly get a better quality of life. So what is pain? We always ask ourselves, what is pain? Why do we have pain? Is it a good thing? Is it a bad thing? Pain hurts, it causes suffering. So is it like good? Is it bad? Why do we have it? So, believe it or not, actually pain is one of the oldest medical problems that has ever been documented in history. And pain itself is, we defined it as a very unpleasant sensory and emotional sensation that we experience. And pain has always been our teacher. It teaches us how to avoid sharps, avoid burning ourselves, avoid potential injury to ourselves. So in a way, pain is very important that we have pain in order so that we will be able to avoid hurting ourselves. Of course, at some point that we found using medications like morphine, opioid medication that have been found to be very effective in shutting down the pain signaling pathway. But of course, that was a wishful thinking that we now know that it also causes a lot of problems if you use it in the long run. For example, some people misuse it. There are issues with dependence, addiction, tolerance, and therefore you probably heard about the opioid epidemic and things like that. So we're going to start a little bit about history of pain medicine. How do we go from, where do we go? Where do we start, and how do we get to where we are today? So we start in back in the ancient Greeks, and there's a very famous a scientist and also a philosopher. His name is Aristotle, and he thought that pain is actually coming from evil spirits entering our body, and therefore we experience pain. Hippocrates is also a very famous Greek and also the most well-known oldest Greek physician back in 460 BC to 370 BC, and he believed pain is actually originating from imbalance of vital fluids like our blood, our lymph in the body. There's been so many attempts that has been made over the past 500 years to figuring out ways to control pain without using medications. Back in the ancient Greeks, there's no medications available for pain treatment. So how do they do it? So this is you can see on the right-hand side, there's a 13th century old painting. Basically what this is showing is the person in red dress on the left-hand side is a surgeon. So what he's doing is he's making an incision in the patient's arm. Now, back then, we don't have any medications to help with pain. So what he does is he has his assistant in front of the patient and doing a direct gaze and trying to basically divert his attention, and therefore he will feel less pain when the surgeon makes an incision. How effective is that? Who knows? So this is a picture of back in the days where the ancient Egyptian would figure out a way to clamp the artery in the neck. And so there's going to be less blood flowing into the brain, and therefore they will be able to knock the patient out so they become unconscious that way because they reduce the blood flow to the brain. Unfortunately, we now know that if you do that, that's going to cause the patient potentially putting the patient at risk of a stroke because there's less blood flowing to the brain, or because if there's a blood clot in the neck, and that can dislodge the blood clot and therefore causes a stroke in the brain. So that's not a good way to put someone to sleep or put someone into a state of loss of consciousness. This is another very colorful painting. It's depicting an Egyptian doctor. What he's trying to do is he's trying to put a funnel in a patient's mouth and pour a paste mixed with powder of some kind of herbal medication, and also dead mouse, that thinking that by pouring this paste into the mouth, that it can potentially help with toothache and also swollen gums. In more serious people with more serious pain in their teeth, they even put a whole dead mouse into a patient's mouth, hoping that will help with treatment of pain. But unfortunately, we know that's not gonna work. This is a drawing showing that in the 17th century, Europeans like to they don't like to, but they would consider ingesting human body parts to treat diseases. Actually, this is the European physicians actually learned it from the ancient Egyptian doctors. Basically, it's under a branch of what we call homeopathy, where the concept is like cures like. So what they saw is that the European doctors saw the ancient Egyptian doctors were grinding the mummies' parts into powders, and they use it for treatment of diseases. So for example, they would think that by grinding the human skull into powder, and you take the human skull powders, and that way it will help to treat chronic headache. So that's the concept of like cures like. Again, I don't believe that's going to work nowadays. This is some of the other ways that that we have found that may have been able to help with chronic pain treatment. Snake oil is is something that's almost like an herbal type of medication that's very commonly used in the Asian culture, in Asia, where they use snake oil for relief of pain, for arthritic pain. It's kind of like an ointment where you rub it in areas that hurts, and they found that it helps to reduce pain. Of course, there were times where they believe that this is just fraudulent, that some of the companies were trying to make money from selling snake oil. Not until 1980s, there's a lot of research starting to be conducted looking into why snake oil actually helps with pain relief. And they found that snake oil actually has a very rich source of omega-3 fatty acid. So, and we now know that omega-3 fatty acid is actually helpful in reducing inflammation. And that's the concept behind why they believe snake oil is helpful. You can see that in the bottle, $1 bottle for 50 cents. Pretty good deal. So this is a very, on the left-hand side, it's a very famous drawing It's back in showing that there's a person in a chair that appears to be already have lost his consciousness. And there were surgeons in the front trying to do an incision on him. And so you can see also a person, very famous person. His name is, what's his name? His name is, not his name, but this is a picture in 1846 where it's basically a public demonstration where they were showing how they use inhaled ether to put a patient to sleep. And the surgeon named John Warren in the front is doing an incision in his neck. And the patient was not able to, the first time that it was publicly demonstrated that a patient was able to not feel any pain going through surgery where they use inhaled ether. And you can see on the right-hand side, shortly afterward in 1853, that Queen Victoria was able to give birth to a child without experiencing any pain. What they do is they apply chloroform that will help to reduce the pain during childbirth. But nowadays, we know that chloroform, if you use it, they can potentially put a patient or a person at risk of cardiac arrhythmia, meaning irregular heart rhythm in the heart, and that can cause a patient to develop heart attack and possibly death from overusing chloroform. So by 1900s, morphine, heroin came to use as pain medication. And a little background on how morphine came about. So opium cultivation has been dated as early as 3400 BC. Opium use for pain has been documented as early as the 1600s. And back then, many European doctors would give their patients opium for pain relief, going through childbirth, cancer pain, menstruation. And you can see in the picture on the right, that's basically the milky sap is actually the opium that's being extracted from a flower called opium poppy. And of course, there's problem with opium is that they found, well, it's very addictive. So there were scientists, they were trying to uh, do research and try to modify the chemical structure of opium and try to come up with something that could reduce the addictive property of opium, and thereby they come up and they synthesize morphine out of opium. Now, of course, they think that morphine was able to reduce the addictive property, but unfortunately that did not happen. Actually, morphine provide even a more pleasurable side effect. And you can see in the picture, this is when back in the late 1800s, when the British were trying to um, do a trade with China for their tea. And so what they did was they basically do a trade for opium with the Chinese, and therefore they can get into exchange for tea leaves and things like that. So there was a pretty widespread use of opium in back in the late 1800s in China. And of course, again, morphine, they found that it does have an addictive property, and they were trying to come up with a lot of scientists will then work on coming up with another compound that hopefully that was again able to curb the addictive property. And so there's a guy named Charles Romney Elder Wright, and in 1874 he's a scientist and came up with synthesized heroin and from opium. And Bayer, which is a German pharmaceutical company, in 1898, you can see the advertisement on the right-hand side that they promoted heroin for use in children suffering with cough, colds, and irritation as late as 1912. But of course, they found that again widely addictive, been widely abused, and so they banned under the Heroin Act of 1924. And of course, this is here's a graph, basically data from the CDC, basically showing that there's a significant amount of people dying from misuse of opioid. You can see there's an increase in trend from 2000 to 2015 over a span of 15 years. Basically for any kind of opioid related products, whether it's basically for any opioid, there are heroin, there are other things like semi-synthetic opioids, methadone, fentanyl, and tramadol. And this is another piece of data that the CDC published, showing that some of these states have statistically significant increase in death rate from overuse or misuse of opioid. And of course, happens to be one of them is California. So basically, the question is it safe to use opioid to treat pain? So the short answer is it really depends. And it depends on partly the type of pain that you're dealing with. And of course, there's two major types. There's the acute pain and there's the chronic pain. So we'll start with the acute pain. Acute pain is basically when the source of the pain is very clear. For example, you broke your bone, you touch something that's very hot, you underwent a surgery, you have appendicitis. So these are acute pain that happens suddenly because there's an injury to the body. So the source is very clear, it's clearly identified. So they tend to be, the duration of pain tends to be more short-lived. And they, most of the time, we respond pretty well to medication, including opioid for acute pain. However, chronic pain is completely different. Chronic pain is a disease. Chronic pain sometimes doesn't really serve a purpose. It's a disease that there are times where patients would have some kind of injury, but that injury has completely healed, but the pain persisted and becomes a disease, a chronic pain disease for months or even years. So and sometimes chronic pain, the source of chronic pain is not very clearly cannot be clearly identified. The source may not be very clear, may even be unknown. The duration is defined as more than 6 months. And also, for patients with chronic pain, they don't tend to respond very well to most, if not all, medications. So chronic pain is much more difficult to manage. So why is it important to manage chronic pain? So we can take a look at this little pain cycle. We call it like this picture. So if you look at the 12 o'clock position, basically you start with a patient having persistent pain, chronic pain. He's suffering pain every day, constantly, 24/7. So then because of the chronic pain, they become much less active. They're not exercising. They don't want to walk. They don't want to move around. They just want to lay down because they hurt. Because they started to be less active, they're going to lose the fitness. They're going to be weaker. They don't exercise. Their muscle undergo atrophy. Their joint are less mobile. They're less flexible. So, chronic pain can interfere with their sleep. So they become lack of energy. They become very tired during the day. And because they don't sleep well, they become weaker. They are less active. They started to become very anxious, frustrated. They get angry because they can't function. They started developing negative thoughts. They may even think about having suicidal ideation. They become very depressed. They have mood swings, and they can they can't go to work. They may lose their job, and therefore money become a problem. Because they always get so frustrated. They get angry, anxious, and they can run into problems with their significant other, and therefore that create even more chronic pain. So that's why it's early to manage chronic pain, and therefore it doesn't undergo this vicious cycle where the chronic pain become worse and worse over time. And of course, for interventional pain management physicians like us, we see a lot of especially chronic pain involving the spine. And there are many causes of chronic pain. We see patients with neck pain, thoracic back pain, low back pain, tailbone pain, all kinds of things. Some of the most common causes, by far the most common cause of low back pain, the most common cause of pain, chronic pain is actually low back pain. And whether it's seeing a pain management physician or seeing a primary care doctor, the most common cause is actually low back pain. And some of the potential source of low back pain include degenerative disc disease. Basically, it's referring when the disc is degenerated, wear and tear. Spinal stenosis is one cause of low back pain, where people will develop weakness. They will have difficulty walking, standing. Patients will be telling me, "Oh, I walk for 10 minutes, 5 minutes, I have to sit down." They may also develop, because of spinal stenosis, they may develop something called reticulopathy. Many people will refer it as sciatic pain, basically a pain shooting down the leg where they will feel numbness, tingling, pins and needle sensation. Some people said it may feel like burning sensation. Other common causes of chronic low back pain, including facet arthropathy, basically arthritis in the joints in the back. Sacroiliitis is a little bit less common cause of low back pain, but could also be affecting quality of life. Coccydynia is basically referring to tailbone pain. We also have patients suffering from peripheral neuropathy. Basically, they would get pins and needle burning sensation in their feet, in their hands, and that can be as a result of things like alcohol use, vitamin deficiency, or even diabetes. And of course, a lot of the patients actually we consider idiopathic, meaning we don't really know what the underlying cause of that. Other common causes of chronic pain, like chronic abdominal pain, pelvic pain. We see patients with complex regional pain syndrome. This is usually as a result of an injury to a nerve or an injury to one of the limbs, like your hands, your arms, or legs, things like that, that can lead to something called complex regional pain syndrome. And that is when the sympathetic nervous system get very angry and started causing pain in the limb. People will also have swelling, reduction in their mobility, things like that. Other common causes like myofascial pain is actually a very common cause of pain throughout the body. Compression fracture, something that we see pretty often in this area, especially we have a patient population, especially in a patient population over 65 years old, we do develop compression fracture. Sometimes it's because of a fall injury, motor vehicle accident, but sometimes it may just be spontaneous as a result of aging due to osteoporosis, osteopenia. Other causes of chronic pain like headache, fibromyalgia, cancer pain, and also trigeminal neuralgia are some of the examples that we see in our clinic. And the prevalence of chronic pain, at least 10% of the world population is affected by some type of chronic pain condition. Each year, at least 1 in 10 people develop chronic pain. And of course, the World Health Organization told us that reported that osteoarthritis affects 10% of men and 18% of women aged about 60 years old. Rheumatoid arthritis affects about 0.3 to 1% of the general population, but I'll tell you that rheumatoid arthritis is by far one of the most severe debilitating disease. It's not very common, but it basically affects every joint in the body, and the pain can be very debilitating if it's not being managed properly. And of course, low back pain affects nearly everyone at some point in our life, including myself, and about 4 to 33% of population at any given point. So when patients come to see us, interventional pain management physicians, and we always start with a pain assessment. First thing we do is we ask them about clinical history. Where's the location of your pain? Where does it hurt? Does it radiate? Is there any other symptoms associated with it, like numbness, tingling, weakness? How would you describe the pain? Does it get better if you do certain things? Does it make it worse? Does the pain get worse with certain activities? And just a lot of time, just by clinical history, we will be able to pretty much come up with a diagnosis without any other things. Of course, we still do a physical exam on our patients, and we get some of the imaging studies. All these combined with the clinical history will help us to come up with a definitive diagnosis of what causes the pain that the patient is suffering from. And therefore, we can come up with a customized treatment plan for that specific patient. And so how do we measure pain? Blood pressure, heart rate, all these things. We have all these tools, we have all these equipments that we can actually measure. There's a number that will come up. But we've been studying pain for years and years, but we never really have a tool to definitively come up with how we can measure pain. And the best thing we could come up with is basically what we call a visual analog scale. So it's a 0 to 10 scale. Basically, we ask the patient, how do you feel? How would you rate the pain? So, compared to something like blood pressure and heart rate, which is an objective finding, pain scale is very subjective. I could have I could possibly walk into a patient's room, and a patient would be sitting there looking pretty comfortable, and he would give me a pain score of an 8. And then I would have a patient going into another room, see another patient. He's standing, leaning forward, his back hurts, he's using a cane, he's not comfortable, he's sweating, and he would give me a pain score of a 6. So that's why, this is the best way we can do to measure our pain, but it's still very subjective. There are some academics institute, they are doing some researches, they are actually drawing some of the biomarkers from the body. They draw blood from and picking some of the biomarkers and trying to figure out a way to objectively measure pain. There are some evidence that some of the biomarkers seems to suggest how to measure pain, but ultimately nothing is definitive at this point. So when it comes to treatment of chronic pain, which is kind of the whole concept of the whole lecture title of what we're trying to address is, how do we treat it? And there's a lot of studies, research being conducted at some of the major academic institute, and there's a lot of studies that have been conducted. And by far, the best way that they found in terms of treatment of chronic pain is through a multidisciplinary approach. What that means is a combination of a couple of things: a non-pharmacological approach, a pharmacological approach, and interventional approach. The combination of these three found to be the most effective. So we'll start with the non-pharmacological approach. Basically, you can see it contains a whole bunch of different types of treatment modalities that you can potentially consider. Cognitive behavioral therapy and biofeedback are some of the strategies that psychologists tend to use to help patients with chronic pain. And these two techniques have a lot of evidence already supporting the effectiveness in helping patients to reduce their chronic pain. They help patients basically to, they train the patient's brain and body to learn the process of generating chronic pain, and therefore they will be able to better cope with the chronic pain on a daily basis. Also, they train to eliminate some of the negative thoughts that patients may have subconsciously because of chronic pain. And of course, there's physical therapy and aquatic therapy that we tend to find them to be very helpful, especially people with spinal pain. The concept of physical therapy a lot of times is, we want to, the goal is to improve their mobility and also their flexibility, and also by when we refer patient physical therapy, we also try to improve their core strengthening. We want to strengthen their core. By doing that, that will help to reduce their chronic pain. Because when you strengthen your core, you basically retraining and also strengthening the muscles, and therefore it will help to increase the blood flow and draw the blood flow into that area. And therefore, when your muscles get stronger, it will help to reduce pain. A lot of time I tell patients, people with arthritis, spinal stenosis, it's something that we have as we age. It's inevitable. We can't reverse this process. The only way to compensate for this problem is by strengthening the muscle, which is something we have control over, by strengthening the core. And that's why I think physical therapy is very important when it comes to management of chronic pain. Aquatic therapy is especially helpful in patients with, for example, arthritic pain, hip arthritis, knee arthritis, low back arthritis. These are very helpful when it comes to aquatic therapy. Chiropractic manipulation and acupuncture therapy are two other ways of non-pharmacologic approach. Chiropractic manipulation are basically using manually adjusting the spine and posture the spine that may has been misaligned. So that usually helps with chronic pain. Acupuncture, there are some moderate evidence that showing that they can be effective for treatment of chronic neck and low back pain and also knee pain. The evidence is moderate. They are still doing a lot of research to confirm. The theory behind acupuncture is, the old theory is basically saying that by doing acupuncture, it opens up some of the channels in the body that will, that some of these channels may have been obstructed. So doing these acupuncture will help to open these channels and release what they call in the ancient culture, the Asian culture called qi. It's basically the flow of energy. Now that's just a theory of how acupuncture works, but there's also a lot of research being conducted now that they found acupuncture actually induce the release of it's called it's a form of morphine that produced in the body. So basically, by doing that, that will help to alleviate the patient's chronic pain. There's other things like yoga, tai chi that we also encourage patients to do, because yoga, tai chi, they help to improve your flexibility, your mobility, and also it helps to learn to train your breathing technique, and therefore help to relax your body and therefore improve your reduces your chronic pain. Massage therapy is especially helpful if you're suffering with myofascial pain syndrome, if you have a lot of muscle pain, muscular pain. Weight loss, definitely helpful. Especially, why do a lot of pregnant patients, they tend to have low back pain because they have a baby in the front that kind of put a lot of stress in the back. So similarly, if you're heavy, if you have a lot of weight in the abdominal region, that can also put a lot of stress in the back. So weight loss will certainly help with reducing your chronic pain. Smoking cessation, there's already a lot of research showing that nicotine contribute to chronic pain. So stop smoking will also help. And of course, there's diet modification. Specifically, Some of the dietary recommendation include reducing your cholesterol intake. Some of them, like by taking fortified milk, yogurt, eating nuts, oats, fiber-rich products, soy protein, all these will help to reduce cholesterol. And we now know that cholesterol actually increase your inflammation in the body. And so the current recommendation is reduce your cholesterol so your body is less inflamed. Weight loss and exercise, like we just discussed, it's going to be helpful for reducing your chronic pain. Other things including increase your intake of long-chain omega-3 fatty acid. If you recall earlier, we were talking about snake oil. There's they have a rich source. They are a rich source of omega-3 fatty acid because it helps to reduce inflammation in the body. Some of the rich source of omega-3 fatty acid, like oily fish, tuna, salmon. If some people don't like oily fish like tuna, salmon, you can always take 1 to 2 tablets of fish oil capsules on a daily basis. That will also help. And of course, we encourage using oil rich in monounsaturates like olive oil. They tend to be healthier. Vitamin D is also very important. They are a good source from vitamin D, include oily fish, egg yolks, and some of the fortified milk products and cereals. And sometimes if you don't take those, a sun exposure of your skin will absorb vitamin D for just 10 to 15 minutes a day. You expose to the sun, you should get enough source of vitamin D as well. So, and vitamin D is important as you know, like a lot of time, people with osteoporosis, the physician will recommend take calcium and vitamin D because vitamin D actually facilitate the absorption of calcium. So a lot of people with osteoporosis, you don't just take calcium because you have to have vitamin D to actually help to facilitate the calcium being absorbed. And vitamin D is important for bone metabolism and cell survival, cell proliferation, things like that. And vitamin K, which is a rich source of in many leafy vegetables, also important for cartilage metabolism. So is there any specific recommendation or anything that you should avoid eating, for people suffering with arthritic pain? Generally speaking, no, there's not really any food that you have to avoid eating. Of course, there are some recommendations saying that, you can avoid eating red meat, things that may be pro-inflammatory. So those are also good recommendations, but really there's no specific food that you have to avoid in order to reduce inflammatory pain. So that's the non-pharmacologic side of non-pharmacological type of treatment modalities for pain, for chronic pain. Now we're going to get into the pharmacological. Some of my favorite is topical agents. The reason why is because topical agents, they are topical. You don't have to take them orally, so they don't really affect your whole body. They don't affect, you don't take it orally, so it doesn't affect all the system in the body. So topical, the worst scenario is you may get an allergic reaction from the topical agent, but otherwise the amount of we call it systemic uptake, meaning being absorbed into the body from the skin, it's very, very, very minimal. So the potential side effect that's affecting your body or your organs is very minimal. Of course, some of the common over-the-counter medication that we use, NSAIDs is something that would help to reduce inflammation, like Aleve, ibuprofen, Advil, naproxen, Motrin, you name it. Those are NSAIDs. They are anti-inflammatory pain medication. Acetaminophen, basically Tylenol, is something that it's more targeting. It doesn't have the anti-inflammatory property, but it does have help with musculoskeletal pain. And one thing that I tend to like to teach patients is that the combined use of acetaminophen and NSAID tends to produce even a much greater effect when it comes to pain relief. Other forms of pain, the medication that we prescribe, including muscle relaxant, that tends to help with muscle pain. Oral steroid is something that's more important for people who have some type of autoimmune disease like rheumatoid arthritis, or some people suffering chronic pain from lupus. It's not something that we encourage chronic use because chronic use of steroid also could potentially put you in risk of other long-term side effects. Something that we commonly prescribe also is antidepressant and anticonvulsant. They are very effective medication for, especially for people suffering with some type of nerve pain, like neuropathy. Herbal medication, there are some herbal medications like turmeric extract and magnesium oxide. There's some small studies that have been shown that they may be effective in reducing inflammation and also contributing to muscle relaxation. And of course, there are some of the other medications that are less commonly used that are maybe in experimental phase, like low dose naltrexone therapy, ketamine, things like that. And of course, that's the pharmacological side. Now, then we go into the interventional side, which is what we specialize in. Many interventions that we do for spinal pain, including trigger point injection, where we use it for treatment of myofascial pain. Epidural steroid injection are indicated for treatment where people are suffering from spinal stenosis or some type of reticulopathy, meaning like sciatic pain. Facet joint injection and medial branch block are a way to treat patients for low back pain related to arthritis in the joint. Bursa injection is something that very commonly found in many patients. And sacroiliac injection is another joint injection that we do for treatment of low back pain. Piriformis muscle injection, which is something also very common that we do. And spinal cord stimulator, which is something that's a little bit more advanced in for patients who suffer with chronic pain, but they may not be a candidate for surgery, they may not want surgery, or they may have exhausted most, if not all, the pharmacological or conservative or interventional treatment. So we will start with something to do with myofascial pain syndrome. So myofascial pain syndrome is one of the very common cause of neck pain, low back pain, or basically it can involve any body parts. This, you can see that one of the common areas is the area where we call it the trapezius muscle. It's around the shoulder and the neck junction area. And you can see that people with myofascial pain, they basically having muscle pain. And a lot of time patients will come into my clinic and they would be telling me, I feel this knot in the a knot in the muscle right here, or they will feel like a nodule there, or they will tell me, this area is really tight. It's like a tight band here. All these are evidence of myofascial pain or muscle pain, and so they can become inflamed. So another common cause of low back pain is facet joint problem. It's like we have joints everywhere in the body, elbow joint, shoulder joint, and same thing. We have joints in the neck and low back that allow us to rotate our neck. We allow us to bend forward, bend backward, and twist our low back. And they can develop chronic pain. And I have patients with low back pain that can generate referral pattern where they will have pain radiating down the back of the thigh or the side of the thigh. And also I could have patients with chronic neck pain that will develop like a headache in this area, and they may even complain of pain going to the shoulder. And so a lot of times they would think that, I might have shoulder issue, but really it's coming from the neck. So these facet joints, just like I said, we have joints everywhere in the body. Same thing, we have joints in the back, and they can undergo wear and tear as we age, because we bend forward, we walk, we stand for 60, 70 years of life. So they're going to undergo from a normal joint into basically bone on bone, where they become wear and tear. The downside of pain in the neck and low back is it's not like knees and hips. We can just, replace the hip, replace the knee, we're good to go. The problem with neck and back, we really don't have the technology to replace your spine. So that's why we come up with other ways to treat the pain in the neck and back while helping our patients to avoid surgery. And one of the ways is for chronic patients suffering with chronic low back pain or neck pain due to arthritis, is we do something called medial branch block and radio frequency ablation. So like I said, people with neck and low back pain, we can replace your spine. And also surgery is usually not a good option. What they do for surgery in the old days is they do a fusion, and that can potentially lead to create some of the problems. So So what most of the surgeons now is, if the patient is having chronic neck or low back pain that is related to arthritis only, they would not recommend surgery. They would recommend basically interventional treatment like radio frequency ablation. The concept behind is that there's a tiny little nerve that send the pain signal into the joint. So these nerves are not responsible for any kind of motor activity, meaning moving your neck or moving your arm. They are purely a sensory nerve, meaning that all they do is send pain signal into the joint. So what we do is we test these nerve. We do an injection near the nerve to make sure that the patient has good relief of their neck and low back pain after the shot. So basically, we are temporarily shutting down the nerve to see if it will help to alleviate the patient's pain. If it does, then we ultimately put the needle in those locations to burn and destroy the nerve. Sure, it's not a permanent fix, but it's a good way to provide patient with long-term good relief. We have patients that could last as long as there are patients who may get 6 to 12 months of pain relief or even longer. And other common causes of low back pain, like or neck pain, including spinal stenosis, and basically it's a condition where the spinal cord become very narrow, and so potentially many causes there could be because of, you can see down here, there's a herniated disc that can lead to impingement of the spinal cord. You can see the right hand side. This is an MRI of the normal neck. You can see the spinal cord, very pretty. You can see the white color fluid. You can see that this is how normally the spine, you'll see the white color fluid flowing through without problem. Patient with spinal stenosis, they have herniated disc, they have disc bulge, and that can lead to narrowing of the spine. And you can see the white color fluid was not able to pass through these areas. So, and they can develop pain in the neck, pain in the low back. They can develop pain shooting down the arms and legs. They can cause weakness. They can cause numbness, tingling, things like that. And spinal stenosis, you can see that these are some of the pattern of what we call reticular pain pattern. Basically, when you have spinal stenosis, they may be affecting a certain type of nerve. So that's why a lot of time when the patients tell us, oh, my pain go down to the thumb, we know that it is a C6 nerve being affected. Same thing, we would have patient complaining, oh, pain is going to the front of the thigh, and we know, okay, it's the L3 nerve being affected. So, so that's why a lot of times, just from clinical history, we will know what kind of nerve is being affected and things like that. So, how do we treat spinal stenosis? Probably by far one of the most effective, minimally invasive procedure that we do is an epidural steroid injection. Basically, we put a needle into the epidural space, which is a space laying right outside of the spinal canal. And so that's an empty space where we put the needle and inject some of the steroid to help to alleviate some of the pain. And that will calm the inflammation in the nerve or also the spine. You can see these are some of the X-ray picture that where the needle, you can see the needle going in there and putting then the black color is basically contrast, showing that the medications are going into that area. Same thing on this picture right here. You can see the nerve coming out, and that's what we inject the medication through. So another form of common cause of low back pain is sacroiliitis. You can see the sacroiliac joint here, and we also do some type of we do cortisone injection to help alleviate the pain as well. We also do certain patients. We do radio frequency ablation for long-term pain relief for this type of pain. Other common causes of chronic pain like greater trochanteric bursitis and bursa are very common cause of pain. Bursa itself is a fluid-filled sac that is basically serve as a cushion between muscles and bones. So they can become inflamed. For example, greater trochanteric bursitis tends to be common in patients who tends to lay on one side when they sleep, and that can cause pain in the side of the hip. A lot of time we just do a cortisone injection that usually takes care of the problem. And of course, when patients suffering with greater trochanteric bursitis, there's really not much surgical option. It's really, coming from the interventional pain management side. This is just another form of bursitis. It's called ischial bursitis. Patients usually complain of pain in what I call kind of like the the base of the butt, kind of connecting between the butt and the junction of the hamstring. And so they usually complain of focal pain in that area. Again, we do a cortisone injection that usually takes care of the problem. Other common causes of pain like piriformis muscle syndrome, usually a lot of patients, some patients will have just local pain in the buttock, but also there are patients that because the piriformis muscle, when it gets injured, it can compress the sciatic nerve, and that some of the patients with piriformis syndrome, they can also develop sciatic pain. This is just an example of how we do piriformis muscle injection. And other intervention technique that we do, including sympathetic nerve block, radiofrequency ablation, and chemical neurolysis for patients suffering with some of the abdominal pain condition, pelvic pain condition, or complex regional pain syndrome. So specifically, stellate ganglion nerve block, I'm going to fly through some of these intervention techniques because they are a little bit more advanced. And some of them that we do is stellate ganglion nerve block. It's for complex regional pain syndrome that for the arms and the hands that we do for our patients. You can see this is a picture of an interventional technique that we do for this type of injection. Celiac plexus nerve block is something that we do for patients suffering with chronic upper abdominal pain. We do this also for sometimes patients with chronic pancreatitis can also be very effective. Lumbar sympathetic nerve block, we do that for patients suffering sometimes with neuropathy of the legs or complex regional pain syndrome as well. Superior hypogastric plexus nerve block is something that we do for patients suffering with chronic pelvic pain. They may be having Crohn's disease, diverticulitis, chronic diverticulitis. They may be suffering with endometriosis for younger females. So that's something that we do. Ganglion impart nerve block is something that it's indicated for patients suffering from chronic rectal pain. I have patients who have chronic tailbone pain that seems to be also effective for pain relief. Again, they're not permanent fix, but they are a good way to manage pain for a long period of time. And of course, compression fracture is something, like I said, pretty common in our patient population who are age above 65 because of osteoporosis. You can see that these are normal vertebrae, and when they become fractured, they can form into what we call almost like a wedge shape. What we do is we put a trocar or needle into the vertebrae that's fractured. We open a balloon and we fill it with cement, and that tends to help to alleviate the acute pain caused by the compression fracture almost instantaneously. And of course, we do Botox intervention for chronic migraine headache, and some of the interventional treatment that we do for a very debilitating facial pain called trigeminal neuralgia. And also some of the advanced technique that we do, specifically we call it neuromodulation. As you can tell from the term neuromodulation, basically we're trying to do something to help to modulate the neural pathway and therefore shutting down the pain pathway. Two of the techniques that we commonly use, one is spinal cord stimulator, and the other one is something called intrathecal drug delivery system. So spinal cord stimulator is indicated for patients who have basically leg pain, nerve pain, that they already went through surgery, but because they, from the surgical standpoint, all the structural problem has been fixed, but they're still suffering with chronic pain in the low back, in the neck, or going down the arm or the legs. And that may be because of the nerve has already been permanently damaged. And so what we do is we do spinal cord stimulator for patients like that has basically what we call failed back surgery syndrome. Other things that's indicated, including reticulopathy, like I said, kind of like sciatic pain, or a complex regional pain syndrome. So one example is patient who suffer with shingles, who develop shingles, but the shingles is all healed up, but their pain never resolved. And they would be suffering from chronic pain for years and years after the shingles. And so spinal cord stimulator tends to be very helpful and indicated. This is just a picture basically showing how spinal cord stimulator works. I mean, in a way, nobody really knows how spinal cord stimulator works. There's a lot of research being conducted to try to figure out how it works, but nobody really knows the definitive way of how it works. So the old theory is that we believe that there's something called gated theory. So you can see here's the brain, here's two railroad tracks. There, and these two railroad track, there's only one of the one of the we'll call it, it's one of the trains can only pass through, so not both trains. So normally you can see this is called pain. The pain train will be able to pass through and get to the brain and process, and therefore we feel pain. Now, what neuromodulation or spinal stimulation does is that we basically shut down this train track, and we open the other train track, which we can call it something like numbness or tingling, that this train track will be able to go through it. So basically, that's the theory behind the gated theory behind how neuromodulation works, is that the spinal stimulator would shut down the pain pathway and open another pathway so that patients feel less pain when they, when the spinal cord stimulator is on. And so this is some of the pictures that how we perform, how the some of the spinal cord stimulator leads were properly placed in the spinal canal and help with alleviating our patient's chronic pain. This is another way of neuromodulation intrathecal drug delivery system. I don't personally do this type of procedure, but there are pain management physicians who do interventional pain and perform this type of procedure. It's basically a pain pump where you can see there's a catheter. They insert it into the spinal canal and constantly delivering medications into the spine for pain relief. And these things can be implanted once we do a trial to make sure that it works for you. So looking into the future, what are some of the potential treatments options out there for chronic pain? One of the most discussed topic and one of the most that a lot of people are looking forward to is regenerative medicine. So a lot of you may have heard of stem cell therapy. And what we do here is we do something called platelet-rich plasma, which you may also have heard of. And so basically the concept of regenerative medicine is we draw some blood out of the blood out of the patient himself or herself. And what we do is we spin it down, we extract the platelet, the plasma that's rich in platelet, and we inject it into the site of injury. So if you imagine, if you have a cut in the finger, it bleeds, and then the bleeding stops. What stopped the bleeding is because of the platelets were there to heal the area. So now some of the areas like the joints in our back, the joints in our knees, they may be difficult for the blood to get to, and therefore the platelets are difficult to get to. So they don't have the chance to regenerate or repair. So what we do is by drawing the platelets and directly inject it into the injured site, that will help to facilitate repair and regeneration of the area, the tissue, the tendon, or the cartilage. So that's the concept behind it. And so that's, in summary, we talked a lot about, how we treat chronic pain. We talked about how chronic pain can be very debilitating and that we should address it early because the earlier you diagnose chronic pain and the earlier you intervene, the less likely it becomes, the better quality of life you'll get. So that's why early diagnosis and intervention is important. Opioid is not really a solution for chronic pain like we discussed. There are a lot of data from the CDC already published showing that it causes other problems like misuse, addiction, tolerance, dependence. And the best way to treat and manage chronic pain is through a comprehensive multidisciplinary approach. And of course, good communication between the provider and the patient is always important. You guys, provider and patient should communicate well so that the provider know exactly, what's the best way to treat your pain and manage your pain based on, your condition, based on maybe your family, maybe some patients, they need to take care of their significant other who may have Alzheimer's disease, things like that. So, and also interventional pain therapy should be considered as early as possible that way that will help to manage your pain better. Yeah, thank you.